Hey, it's your friend here from Book Podcaster, and today we're tackling something really important, but it can feel a little intense. Think of this as just us, like huddled together, maybe over coffee, going through your notes on personality disorders. Seriously, like your study buddy right now.
Mhm.
We're just trying to make sense of it all in a pretty chill way, because let's be real, this stuff can sometimes feel like untangling, I don't know, a giant knot.
It really can. And what we're diving into today is understanding personality disorders. It's so key to remember these aren't just like someone having a bad week or having a few quirks. We're talking about really enduring patterns, ways someone experiences the world and behaves. And these patterns, they cause significant difficulties, real problems in their lives.
Totally. And to help us sort through all this, we're leaning on some solid source material. We've got key concepts from psychiatric mental health nursing, concepts of care in evidence-based practice, the 10th edition. So, good stuff.
Right. And our mission for this deep dive, it's pretty simple, really. We want to break down what personality disorders actually are, make it clear, but also give you some real insight. Because if you're navigating mental health complexities, maybe for nursing school or even personally, it can feel like this huge mountain of information, really.
Definitely.
So we're here to just highlight the crucial stuff, the key takeaways that, really matter.
Okay, let's unpack this then. So,
Hmm.
what is a personality disorder fundamentally? Because everyone's got their things, right? Where's that line?
Yeah, that's the big question, isn't it?
Yeah.
Basically, a personality disorder is this enduring pattern, a pattern of inner experience, how you think, feel, and behavior. Now, what makes it a disorder, and this is key, is that this pattern deviates, like significantly. It's different from what's generally expected within their culture.
Okay.
Think of it as a way of seeing the world, interacting, that's just consistently kind of out of sync with people around them.
Gotcha. So it's way more than just like preferring weird pizza toppings.
Exactly. And these patterns, they're not just occasional blips, they are inflexible and pervasive.
Pervasive,
Meaning
meaning.
they show up across a whole range of situations, work, relationships, family, pretty much everywhere.
Mhm.
And crucially, these patterns lead to significant distress for the person or impairment in really important areas of their life, like can they hold a job? Can they have healthy relationships?
Right.
It's not just about being different, it's that the difference causes real, tangible problems.
So it's really messing with their day-to-day in a negative way. Okay. Where does this stuff usually come from? What are the roots?
Well, the sources point to a mix of things. It's usually pretty complex. Early life experiences play a big role. Things like trauma or maybe really unstable childhoods, those can be significant factors.
Hmm.
And there also seems to be a genetic piece. Like some people might just have a greater vulnerability, biologically speaking.
Okay.
So it's rarely just one single thing. It's usually a combination of sort of their inherent predispositions and what life has thrown at them.
Right. Nature and nurture, the classic combo. Okay.
Mm.
Now, I remember reading about these things being grouped into clusters, was it?
Yes, exactly. The DSM-5, that's the big diagnostic manual, uses a cluster system. It's basically a way to organize the different personality disorders based on some shared characteristics. It helps make sense of the broader themes.
Okay.
There are three main clusters, A, B, and C.
A, B, C. Simple enough.
Yeah, it's just a way to kind of categorize them based on some general similarities and how they tend to show up.
All right, lay it on me. What are these clusters about? Give me the headline.
Cluster A is often called the odd or eccentric cluster. People in this group tend to have ways of thinking and behaving that might seem, well, unusual or strange to others.
Odd or eccentric. Yeah.
Then there's cluster B. That's the dramatic, emotional, or erratic cluster. This group is really characterized by intense, often unpredictable emotions and behaviors. They can have real struggles in relationships.
Okay, dramatic, emotional, erratic. Sounds lively.
It can be. And finally, cluster C is the anxious or fearful cluster. Here, the main features really revolve around significant anxiety and, well, fearfulness, especially in social situations or relationships.
Odd eccentric, dramaticiational, anxious, fearful. Okay, that framework actually helps a lot already. Let's dive into cluster A first. The odd and eccentric folks. What kind of things we're talking about here?
So generally, people in cluster A might seem a little detached, maybe, out of sync with social norms. They often find it hard to form close relationships because their way of thinking or behaving just makes it difficult for others to connect.
Makes sense.
This cluster includes three specific disorders: paranoid, schizoid, and schizotypal personality disorders.
Paranoid. Okay, it sounds like more than just, being a bit
Oh,
cautious.
absolutely. Paranoid personality disorder isn't just caution. It's a pervasive, deep-seated distrust and suspiciousness of other people. And it's often unwarranted. They might constantly interpret others' motives as malicious, like someone's out to get them, even when there's zero evidence. They might read hidden threats or insults into totally innocent comments or events.
So, like that example in the notes, Mr. J refusing his meds because he's convinced the nurses are trying to poison him, that level of distrust.
Exactly that. That's a perfect illustration of that kind of unfounded suspicion. It's not just being wary, it's how they fundamentally see the world and the people in it. Pretty intense.
Yeah, definitely intense. Okay, what about schizoid PD? Does that just mean someone who really, really likes being alone?
Well, they certainly prefer solitude, but it's more than that. The core of schizoid PD is this broader detachment from social relationships, and also a really limited range of emotional expression. They often genuinely don't desire close relationships, and they can seem indifferent to praise or criticism, like it just doesn't register much.
Hmm. So it's not like they're afraid of people, necessarily. It's more like a lack of interest in connecting.
Pretty much.
Like that hospital janitor example, perfectly happy working alone, doesn't really interact unless they absolutely have to.
Precisely. Unlike, say, avoidant personality disorder, which we'll get to in Cluster C, people with schizoid PD aren't usually avoiding folks out of fear of judgment. Their preference for being alone seems to stem from a fundamental lack of interest in those close bonds.
Okay, got the distinction. Now, schizotypal.
Yeah.
That one sounds, well, it mentions magical beliefs and eccentric appearance. Bit more out there.
Yeah, schizotypal involves some odd thinking patterns and perceptual distortions. Things like magical beliefs, maybe thinking they have psychic powers or something like that, or ideas of reference feeling like random events have special personal meaning just for them.
Yeah.
They might also behave eccentrically, maybe dress unusually, and they often have significant social anxiety, but it's the kind that doesn't really ease up, even with people they know.
Right, so like believing in telepathy or thinking mismatched clothes or spiritual armor, that's definitely a unique perspective.
It is. And these beliefs and behaviors, while not full-blown psychosis like in schizophrenia, they do represent this pattern of unusual thinking and social difficulty that makes relationships really hard.
Okay, cluster A recap. Paranoid is distrustful, schizoid is detached, schizotypal is eccentric thinking and socially anxious. Got it. Now, let's brace ourselves. Cluster B, dramatic, emotional, erratic. It sounds like it might get a bit complicated.
You could say that. Cluster B disorders often involve major difficulties with managing emotions, controlling impulses, and maintaining stable relationships. Big challenges there.
Right.
This cluster includes antisocial, borderline, histrionic, and narcissistic personality disorders.
Antisocial. Okay, that's the one you hear about sometimes in, like, true crime stuff, right? Disregarding others' rights.
That's the one. Antisocial personality disorder involves this persistent pattern of disregarding and violating the rights of other people. Often there's a history of breaking rules, breaking laws, a real lack of remorse for hurting others. Manipulation is common too.
So they might lie, cheat, steal, get into fights.
Yes, and often blame others or rationalize their behavior.
And the notes mention it's more common in prison populations.
It is seen more frequently in forensic settings, yes. But not everyone with antisocial PD is incarcerated, of course.
And they can be charming, right? While being
E-
deceitful.
Exactly. That superficial charm can be part of the manipulation. There's often profound lack of empathy. They just don't get or care about others' feelings. No guilt, no remorse.
Wow. Okay.
Okay.
That's a lot. Now, borderline personality disorder, BPD. This one seems to come up a lot, and it sounds incredibly intense. Unstable relationships, fear of abandonment.
It is very intense. BPD is characterized by, yes, intense and unstable relationships, also a really unstable self-image or sense of who they are. Impulsivity is a big one in ways that can be self-damaging, like spending, sex, substance use, and a deep, profound fear of abandonment, even if it's just perceived abandonment, not necessarily real.
Right.
Emotional dysregulation, difficulty managing emotions is absolutely core, leads to rapid, intense mood swings, and sadly, self-harm behaviors are also relatively common.
That example of Jane, clinging to her nurse 1 minute, then suddenly accusing her of not caring after a small delay. That really shows those quick shifts, doesn't it?
It really does. It highlights that emotional intensity and the fear of being left. Like you said, the emotional dial is just cranked way up.
Creates a lot of turmoil, I imagine.
For everyone involved, yes, both the individual and those around them.
Okay. Histrionic PD.
Oh, yeah.
The name itself kind of hints. Dramatic. Attention-seeking.
That's a good way to think about it. Histrionic personality disorder involves this pattern of excessive emotionality and a constant driving need to be the center of attention. People with this often feel really uncomfortable if they're not in the spotlight, and they might engage in dramatic, even theatrical behaviors just to get noticed.
So maybe flamboyant clothes, exaggerating stories or symptoms, being overly flirtatious, anything to draw eyes their way.
Precisely. And their emotional expressions might seem a bit shallow or like they shift really rapidly to others. It's kind of the performance of emotion to get that attention.
Got it. And the last one in cluster B, narcissistic personality disorder, NPD. We hear narcissist thrown around a lot casually. What's the actual clinical picture look like?
Right, it's used loosely sometimes. Clinically, NPD is characterized by a grandiose sense of self-importance, a belief that they're special, superior. There's also a significant lack of empathy for others, and a constant need for admiration.
Entitled.
Very much so, a strong sense of entitlement. And they can react really badly with anger, even rage if they feel criticized or slighted, or if they don't get the admiration they think they deserve. Underneath all that grandiosity, though, there's often a very fragile self-esteem that relies heavily on that external validation.
So demanding the top doctor, belittling the staff, flying off the handle if challenged, paints a picture of a big ego, but maybe a fragile one underneath, and definitely not seeing other people's perspective.
That's a really good summary. That combination, inflated self-image, lack of empathy, those are key.
Okay, cluster B done. Intense emotions, drama, focus on self, sometimes hurting others. Now, cluster C, anxious and fearful. This sounds like maybe more internal struggle, less outward drama.
Exactly. The disorders here share core features of high anxiety, fearfulness. It's often more turned inward. This cluster includes avoidant, dependent, and obsessive-compulsive personality disorder, or OCPD.
Okay, OCPD, you mentioned distinguishing this from OCD.
Yes, super important distinction. OCPD is a personality disorder. OCD is classified separately, usually as an anxiety disorder. OCD involves intrusive thoughts, obsessions, and repetitive behaviors, compulsions aimed at reducing anxiety from those thoughts. OCPD is more about pervasive patterns of perfectionism, control, rigidity. We'll circle back to that.
Got it. So first up in cluster C, avoidant PD. Avoiding what exactly?
They're avoiding social situations primarily, but it stems from this pervasive feeling of inadequacy, feeling inferior. They are incredibly sensitive to negative evaluation, criticism, rejection, even just the possibility of it.
Oh.
So even though they often really want connection and closeness, they actively avoid interactions because they're terrified of being judged, ridiculed, or shamed.
So it's different from schizoid, where there's a lack of desire. Here, they want connection, but the fear holds them back.
Exactly. That's the crucial difference.
Like that example of someone refusing group therapy because they're just too scared of what others might think or say.
Precisely. The fear of negative judgment is overwhelming and drives the avoidance.
Okay. Dependent PD sounds pretty self-explanatory, relying heavily on others.
Yes. Dependent personality disorder is characterized by this pervasive, excessive need to be taken care of. It leads to clingy, submissive behavior. They have significant difficulty making everyday decisions without tons of advice and reassurance. Taking responsibility for their own lives feels overwhelming.
Needing constant reassurance for simple things like what to wear or eat.
Yeah.
That really shows a lack of self-reliance, doesn't it?
It really does. They might find it almost impossible to disagree with others, fearing loss of support. And they might go to great lengths to maintain relationships, even unhealthy ones, just to avoid being alone or having to fend for themselves.
Okay. And finally, OCPD, Obsessive-Compulsive Personality Disorder. Let's clarify that difference from OCD again.
Right. So OCD has those specific obsessions and compulsions, often recognized by the person as excessive or irrational. We call that ego dystonic.
Yeah.
They cause distress. OCPD, on the other hand, is this pervasive personality pattern. It's about preoccupation with perfectionism, orderliness, rules, control over themselves, others, situations.
Control is key.
Very key. They're often excessively devoted to work, productivity, sometimes neglecting relationships or leisure because of it. Driven by a need for things to be correct, they get really distressed when things aren't orderly or when others don't meet their high standards.
And they might not see it as a problem themselves.
Often not. They tend to see their way as the right way. We call that egocentric. It feels natural to them, even if it causes problems for others or themselves indirectly.
So less about anxiety-driven rituals like an OCD, and more about this deep-seated need for everything to be perfect and controlled according to their rules, like Getting super upset over a slightly messy meal tray, not because of germs, but because it's just wrong.
Exactly. It's about that ingrained belief in the right way and the inflexibility around it.
Phew. Okay, that is a lot of information. We've hit all three clusters. Now, thinking practically, for someone interacting with individuals showing these patterns, maybe you're a nurse, maybe it's someone in your life,
Yeah.
what are some key things to keep in mind?
Yeah, that's crucial. The source material really emphasizes a few things. First, establishing clear, consistent boundaries right from the start. This is especially vital with Cluster B, where limits might be tested or there might be manipulation.
Boundaries. Got it. Makes sense.
Also, try hard to avoid getting pulled into power struggles.
Oh, yeah, I can see
Yeah.
that happening.
It often just escalates things and reinforces those unhelpful patterns. Better to stay calm, stick to the facts.
Okay, boundaries, no power struggles. What else?
Maintaining consistency and structure in the environment can really help. It provides predictability, security. When dealing with manipulative behavior, using a calm, matter-of-fact tone is usually way more effective than getting emotional.
Keep it factual.
Exactly. And of course, especially in a clinical setting, clear, objective documentation is essential. It helps ensure everyone is on the same page with the approach.
Super practical advice. Thanks. The notes also specifically mentioned DBT, dialectical behavior therapy for BPD.
Yes, DBT is a big one. It's an evidence-based therapy originally developed for borderline personality disorder, though it's used more widely now. It focuses on teaching really concrete skills, things like emotion regulation, how to manage those intense feelings, distress tolerance, coping with tough situations without making things worse, interpersonal effectiveness, relationship skills, and mindfulness.
Mindfulness, like
Yeah.
being present.
Exactly. Being present in the moment, non-judgmentally, it's highly structured and often very, very effective for folks with BPD.
In that Townsend note we saw, it's stressed consistency, setting limits, but also empathy, right? While being careful not to accidentally reinforce the unhelpful stuff. Sounds tricky.
It absolutely is a balancing act. It requires being compassionate, but also firm. The goal is always to help the person learn more adaptive ways of coping and relating without sort of enabling the patterns that cause distress. It's a therapeutic tightrope sometimes.
Okay, so beyond specific interactions, what about treatments? What therapies generally work for personality disorders?
Well, the good news is psychotherapy can be really beneficial. It's the main treatment. Things like cognitive behavioral therapy, CBT, that focus on changing negative thought patterns and behaviors. That can be great for some cluster C disorders like avoidant dependent OCPD.
DBT. got that.
DBT, as we said, is primary for BPD. And group therapy can actually be really valuable for many personality disorders.
Sure, is this
Yeah, it provides a space to learn and practice interpersonal skills, get feedback, in a structured, supportive setting. Maybe less so for paranoid PD, given the distrust issues, but for many others, it's helpful.
What about meds? Can you just take a pill for a personality disorder?
That's a common question. The sources are pretty clear. Medications aren't a primary treatment or a cure for the personality disorder itself. They don't change the core personality structure.
Okay, so no magic bullet. Nope.
Nope. But they can play a really important supporting role. They can help manage co-occurring symptoms or related conditions, like if someone also has significant anxiety or depression or issues with aggression.
Right.
So you might see SSRIs, antidepressants, used for anxiety or depression symptoms. Or sometimes low-dose antipsychotics might be used carefully for paranoia, or maybe those transient psychotic-like symptoms you can sometimes see, especially in BPD.
So meds help manage the fire around the edges, maybe. But therapy is needed for the core stuff.
That's a good way to put it. Meds treat symptoms, therapy addresses the underlying patterns.
Got it. Now, what about families? It must be incredibly tough for loved ones dealing with this too.
Oh, absolutely. Family involvement and psychoeducation, educating the family are super important. It's crucial to help families understand that these personality traits are deeply ingrained. Change is usually slow, gradual. It takes time and work.
Manage expectations.
Yes, and giving them info about the specific disorder can build empathy, maybe reduce some frustration or blame they might feel.
Yeah, and boundaries again. Right. For families too.
Definitely. Especially with cluster B disorders, families often need a lot of support themselves. Learning how to set and hold healthy boundaries is vital for their own well-being, and also to avoid unintentionally enabling problematic behaviors.
Are there resources for them?
Yes, support groups specifically for family members, like those for loved ones of people with BPD, can be incredibly helpful, sharing experiences, learning coping strategies.
That real-life example of Sarah going to therapy herself because her sister's BPD, that really drives home the impact, doesn't it? And the need for self-care for the caregivers.
It really does. Caring for someone with a personality disorder can be exhausting emotionally, mentally. It is absolutely essential for caregivers, family members, friends to prioritize their own self-care. Seek support. Remember their well-being matters just as much.
Okay, wow. We have definitely covered a ton in this deep dive. Seriously, tack yourself on the back for sticking with us. Remember, the goal here isn't about just slapping labels on people. Not at all. It's about gaining a better understanding of these really complex patterns, thinking, feeling, behaving, that cause genuine struggles. And if you're feeling a bit like overloaded with all this info, totally normal. It's a huge, complex topic.
Yeah.
But you're here. You're learning. That's what counts.
Yeah.
Seriously.
Absolutely. And I think the key takeaway is just that these are deeply ingrained patterns,
Mhm.
often rooted in early experiences. And while they present real challenges, there are effective therapeutic approaches. There's hope for change and improvement. Understanding the clusters, the examples, hopefully that helps you recognize these patterns with a bit more clarity and, importantly, with more empathy, whether that's in your work or just in life.
Yeah. Take a deep breath. You put in the work today to understand this complex stuff, and that's honestly what matters most. Keep that curiosity alive. Seeking knowledge like this, that's a strength, for real. You totally got this. You're absorbing some really important, really challenging material. And hey, if your brain feels a bit like scrambled eggs right now, go grab a snack, take a walk. You definitely earned it.